And welcome to Lesson 3, which is Billing Opportunities for Nutritional Consulting. Now, in my experience, there's 5 main billing opportunities for nutritional consulting and nutrition-related program services, like weight loss as an example, weight loss programs. So the 5 main billing opportunities are the following. The patient's group health benefit plan. There's usually a subsection there for nutritional consulting. The patient's health spending account. Also disability management, as well as executive medical and longevity programs, and also out-of-pocket services. So we're going to go through all 5 of these so you understand them clearly. But before we do, let's first review the suggested fee schedule for nutritional consulting. As I mentioned earlier, there's an initial consultation and exam and program design. Usually the fee is somewhere between $275 and $350. It's about a 60 to 90 minute visit. Then there's follow-up of those appointments to see how the patient's doing, monitor the progress. Usually it's between 1 and 6 months, probably every 3 months is the average. And that doesn't take as much time, so you're charging $75 to $125 as a rule. And then there are these 12-week programs for people that need weight loss coaching. They're coming into a program that's costing them $800 to $1,000. So in many cases, there's third-party billing opportunities. So let's look at these billing opportunities to get the fees paid for this type of nutritional consulting. So the first is sort of the group benefit health plan that the patient has through their employer. In all these group benefit plans, there's usually a nutrition consulting subsection. Now, very often it stipulates that nutritional consult needs to be provided by a naturopath or a registered dietitian, but it's becoming a little more inclusive for other nutrition experts and people with an expertise, such as those that are ROHPs or RNCPs, who are active members within the International Organization of Nutritional Consultants, the IONC. We're going to discuss those credentials in Lesson 5, so we'll talk about that then. But in the group benefit plan, there's often a section that allows the patient about $500 a year for nutritional consulting that's over and above other paramedical services like chiropractic and massage and physiotherapy and osteopathy. That's for nutritional consulting only. And very often with a proper reporting letter back to the claims adjuster. Even if you're not a registered dietitian or a naturopath, if you explain the service properly and what your training happens to be, very often you'll be able to get the patient to be reimbursed. So we'll talk about that in the next lesson, which is about overcoming billing obstacles. The second area where there's a billing opportunity is known as the health spending account. So many employees have a health spending account from their employer that allows to invest in a health service of their own choosing, which is over and above the standard coverage in the group benefit plan. So often the group benefit plan has certain subsections like drugs and dentistry and vision care and chiropractic, physiotherapy, massage, osteopathy, nutrition counseling from a naturopath or a dietitian, orthotics. Those are sort of, carved in stone there as certain subsections. But then there's the health spending account that's over and above that. Somewhere often $250 to $400 a year that the employee can spend on any health service that they feel is important to them. That can include nutritional consulting in your office. The third area that's growing very quickly is a billing opportunity where you can generate revenue that's paid for by a third party is disability management, offering nutritional consulting for a disability management company. There's a strong growing trend to incorporate wellness initiatives into disability management for both physical ailments and also recovery from mental health disorders like depression, anxiety, post-traumatic stress disorder, PTSD, also burnout. But the lifestyle program needs to be personalized to the patient's need and their status. Because what we see is that getting the patient who's off work more proactive, it improves their recovery, it shortens the duration of their disability, and keeps them more productive in their daily lives, so they're more likely to get back to work. It also not only gets them back to work sooner, but it helps them stay at work once they get there so they don't have a recurrence and have to go off work again. So disability management companies are embracing this approach, and they need trained nutritional consultants who have a true expertise in this area to help manage this aspect of the case. You see, often caseworkers for disability management companies are occupational health nurses, or someone with some allied sort of case management certificate or degree or diploma, but they don't have an expertise in evidence-based nutritional consulting and lifestyle medicine. So they need to bring in a third party to do that aspect. But the nutrition and lifestyle consulting that you do involving dietary modification, specific exercise protocols, giving them even the right supplements, these can make a difference to recovery, to healing, and even enhancing the effects of drugs that they're taking, and also improving the other allied health treatments that they may be undergoing. This is becoming a big role. The fourth area where there's a billing opportunity is for executive medicals and longevity programs. So I recently was brought onto a team of medical professionals who perform these high-end annual executive medicals and longevity-based consultations that they do. So the doctors do a great job of the blood work and ECG and spirometry and the stress electrocardiogram and looking at all these different colonoscopies. They're done, PSA values are evaluated. They get all this information. They give the person a report as to their current health status. But who then is going to take all that information, look at it, and then provide the patient with an evidence-based recommendation around dietary modifications, exercise protocols, supplements, and so on, so that next year when they come back, their blood markers are better, that their health status has improved on many tangible levels. How do you get the person better the following year, not allowing the aging of their body to deteriorate and they end up in worse shape a year later? And that, a lot of doctors don't really have that expertise. So someone with nutritional medicine training who really understands the ins and outs of this can integrate all that information and provide the patient with a very valuable consultation to give them a go-forward program. And that's what I'm doing. So part of that is also to understand the genetic time bombs of aging. How, at certain points in our timeline, when we become more prone to our osteoarthritic changes, or our immune system gets weak, or our memory is going to decline, how do you counter those things using natural interventions so the person has a more highly functioning body and mind for the longest period of time? This is your training. And how do you address certain health conditions that the patient already has using complementary nutrition and lifestyle measures? And what about things that run in their family like Alzheimer's disease, congestive heart failure, colon cancer? Who's going to give the patient a program or advice on how best to suppress the likelihood of those genetic susceptibilities from expressing themselves? That's now becoming part of the annual executive medical and longevity programs that I'm talking about. There's a need for someone to step in and do this. It's a billing opportunity for you. And then there's number 5, out-of-pocket services. You'd be surprised how many patients are willing to pay you out of pocket if you can help them with a pressing health need that they have, even if they don't have any coverage for nutritional consulting. Let me give you some examples from my own practice right now. Older patients who've just been diagnosed with Parkinson's disease, who hear that you get good results slowing down the course of the disease in ways that neurologists are not providing that type of solution. They will pay out of pocket for that. Patients who are cancer survivors who are saying, I want to talk to someone who understands all the clinical studies, can show me all the evidence around what strategies I should be deploying to help decrease the likelihood of cancer coming back, where lifestyle can have that impact. Patients with inflammatory autoimmune diseases, where there's nagging pain day after day. They take their medications, it helps, but they'd like to get it to the next level of improvement, to have more of a pain-free existence, or they'd like to be able to cut back on their medications, which are very harsh on their body. Who's going to provide that advice? Patients will pay out of pocket for that, even if there's no coverage. Men who have prostate glands that are enlarging and really bothering them, or their PSA is rising, soon they're going to need a prostate biopsy. They're afraid to have to undergo this. Who can help improve their prostate health in the short term and sort of stem the tide so they get back on track and their prostate health is improved? Adults that have children, that have kids with ADHD, or they have children who are good athletes, who, with the right kind of coaching and the right sports nutrition to complement their training, could get them that scholarship or get them scouted by the scouts that are coming to town. Give them that competitive edge. That sports nutrition consult can give them that competitive edge. Parents will pay for that if their child is sort of highly competitive. And those overweight patients who hear good things from other people in the community about the work that you're doing for people who are losing weight, who are saying good things about your program, Other overweight patients will come to see you and pay out of pocket $800 to $1,000. That's not going to stop them if they feel that you have a program that's going to get them feeling and looking better. So those are the 5 main billing opportunities that I've encountered and I utilize routinely. But the message remains the same. There's a vast number of people who need to undergo an evidence-based nutritional consultation, and you should be the one to do it. In many cases, third parties will reimburse the patient for either the whole fee or part of the fee. And in other cases, the patient's happy to pay out of pocket to get real professional advice on how to improve the management of an existing health condition, or to lose weight, or to enhance their level of health or competition at a higher level. So the real problem is the lack of trained professionals who are doing a good job in this area. And we'll talk about that in Lesson 5. Now in the next lesson, Lesson 4, I'm going to explain how best to overcome billing obstacles. So I will see you then.